Hi, my name is Anne. I'm a student nurse. Can you give me a report on your patient, please?
Okay, we'll be taking care of Glenn Light in room 619. He's a 67-year-old African American male. His date of birth is January 1st, 1950. He has no known allergies. He's full code. He was admitted Tuesday with diagnosis of stage 2 diabetic ulcer on right heel. Secondary diagnosis is diabetes mellitus type 1.
Uh-huh.
Patient complaint of increased blood glucose readings past 5 days. His results were consistently in the 300s and non-healing wound on the right heel
Okay.
approximately 3 weeks ago. His father died of myocardial infarction at 53. His mother died of lung cancer at 78. And then he had a transurethral prostate resection 5 years ago.
Okay.
His cranial nerves 2 to 12 are grossly intact. He's alert and oriented ×4. His pupils are equal, reactive, round reactive to light. Qualitative defects in being able to identify sensation with pinprick to bilateral lower extremities. His lungs are clear to auscultation in all lobes. His breathing unlabored, also without accessory muscle use. His oxygen sat is 95% on room air. His respiratory rate is 18. S1, S2 heart sounds without murmur, rub, or gallop. He has regular rate and rhythm. He has no carotid or bruit. His blood pressure is 145/72. His abdomen is flat, symmetrical, and soft. No tenderness. Bowel sounds are present ×4 in all quadrants. No ascites, no bruit present. He has a diet, 1800 cal diet, 2 grams sodium restriction. He had an output of 320 milliliters through urine void. His urine specimen was clear and yellow. His skin is dry and intact except for stage 2 ulcer on right heel wound. The wound is 5.5 centimeters by 2.5 centimeters at the largest diameter and 3 centimeters deep extending to the dermis. His wound base is pink, no tiling or undermining noted. He has moderate serous exudate, 5 out of 5 muscle strength in all extremities, no clubbing, cyanosis, or edema to extremities. Patient has pulses palpable bilateral radial, dorsalis pedis, and posterior tibial. His temperature is 98.4. He has heart rate of 80. And no, his blood pressure is 145/72. He has an IV site, right median vein, forearm peripheral. His albumin is 4.2. His bilirubin is 0.7. His ALT is 38. In the elderly, it may be slightly higher. His A1C is 6.5%, which is good diabetic control.
Okay.
His sodium is 141. His chloride is 104. His BUN is 19. His potassium is 3.8. His creatinine is 1.0. His glucose is 290. His calcium is 7.4. His ALT is 38. His ALKP is 97. His protein total is 7.1. And his blood sugar fasting is 310. And with the elderly, it's increased in the normal. It's a little bit more increased in the normal range.
Okay.
So, do you have any questions for me?
Does he have any medication to be administered today?
We will be administering Lispro insulin.
Okay. Can you tell me why he's getting this meds?
Because his blood glucose is 290, so we're going to need to lower his sugar in the blood.
Okay. What action does it have on his body?
It stimulates glucose uptake in the skeletal muscle and fat, which inhibits the hepatic glucose production.
Okay. And when should we question administering this meds?
If the patient has hypoglycemia, kidney disease, liver disease, unusual allergic reaction to insulin,
Does this med have a therapeutic serum level?
If it's the glucose range would be from 60 to 100, and then if the A1C is less than 7%.
Okay. And what's the physiological parameters should we monitor when the medication is being administered?
We want to watch for blood glucose,
Okay.
and then I see that the patient is also taking lisinopril and aspirin, which increases the risk of hypoglycemia. So we want to watch for any anxiety, headache, nausea, vomiting. And he's also taking aliskiren hydrochlorothiazide, which may interfere with the blood glucose control. So we need to monitor if the insulin is actually working.
Okay. What kind of intervention should we teach him while he's at the hospital?
To use the call light and notify us if he's having any allergic reactions, such as rashes, itchiness, swelling. Also to alert us if he has nausea, vomiting. Yeah.
Okay. And what intervention should we teach him while he's taking his med at home?
To follow the doctor's orders as given.
Okay.
To carry hard candy around when he's going out, so that in case he feels lightheaded, he could take the candy to raise his blood glucose. And we'll also teach him to store the medication correctly. If it's open, he can store it in the refrigerator in cool places.
Right.
If he's to also wear a medical ID bracelet.
Right.
And not to use insulin if it's frozen.
Okay.
We will also teach him to check for clearness and colorness. The insulin should look like water.
Okay.
If it's cloudy or has any solid particles, he should throw it away. As well as keeping it out of extreme heat.
Okay, very good. And what are the side effects or the potential adverse reactions does this med have?
So some side effects is hypokalemia, erythema, pruritus, and swelling. Adverse reactions are hypoglycemia and anaphylaxis.
Okay. And how do we know when this med is working?
So we'll be checking his blood glucose, and if the blood glucose is within 60 to 100, it should be working effectively.
Okay. That's all I have for now. Thank you.
Okay, we're going to go administer the medication now.
Okay.
Mr. Light?
Yes.
Hi, how are you today?
I'm good, thank you.
Can I have your name and date of birth?
Yes. Glenn Light, January 1st, 1950.
Okay, how are you feeling today?
I'm doing okay, thank you.
Okay, we're going to be injecting insulin lispro by doctor's orders. Do you have any questions for me?
No, not today.
Okay. Now I'll be opening up my MAR.
What's a vehicle?
Okay, so checking the MAR. We'll see that we are giving insulin lispro. It is at 4:45 current time. Since the patient's glucose level is 290, we'll be administering 6 units.
Okay.
Wash my hands.
Yeah, you caught up. Good job. If it's like that, don't touch it.
Gloves.
Make sure you have. She's probably gonna look at it like that. Make sure that you're not touching the skin. You know what I'm saying? Just right. That way, because if you're touching it,
It takes that level of study.
Okay, now we're going to take out the medication.
Okay.
Now we're going to see if it's clear, colorless, check the expiration date. Expires 2020 October, so we're good. Now I'm going to scan the patient's wristband. Okay. Can I have your name and date of birth?
Yes, Glenn Light, January 1st, 1950.
These questions in here, the ones that I read, yeah, I can tell you all these.
1 second.
So if there's any of these questions, I know that's it. I've also done all of the end of chapter questions.
just think of like the outside, and then because there's been really no other way, they just
Okay, so we
cleaned out.
compare the wristband against the MAR.
There's a lot of them in that med population. No, you're just looking at it. You're just assessing it. That's when you're assessing it, and then when you're taking the culture, you take the culture after you get
Okay,
it.
so MAR came up to like blank. Now we will be scanning the medication.
Can you tell?
Okay, so the name matches with the insulin listro. And the register time is 4:45 for 5 o'clock. And Glenn White, do you have any known allergies?
No.
Okay. And Mr. Light, where was your last injection site?
On my thigh.
Where would you prefer your next injection site?
My stomach fine.
I'm really excited.
We're going to inject 6 units. my god. Where's the needle?
Get a new one.
We're going to dispose this in the sharps container. Going to inject 6 minutes of air.
Feels like she's encouraged to enjoy themselves and our people.
Yeah, that's true.
Maybe practice group doesn't really practice at all.
I know, right?
Now we're going to inject the air in. Now we're going
You have
to
everything you need?
pull out 6 units. Okay, now we're going to have another nurse verify after I scoop. Alright, is this 6 units?
Let's see. Is it a little bit? You have to push some medication in.
Okay. Okay, using the scoop method. Can you verify now?
Yeah, it's 6 units.
Okay. So, Mr. Light, we will be injecting this insulin to you in the right upper abdomen.
Okay.
We're going to scrub the area. Wait for it to dry. Now we're going to insert the medication at a 90-degree angle. Insert. Okay. How are you feeling, Mr. Light?
Good. Very good.
Okay, we're going to dispose in the sharps container. So if you have any signs and symptoms of feeling nausea, vomiting, we'll have the call light next to you.
Okay.
And then if you also have any other signs or symptoms such as rashes, itching, let us know because that's very important.
I will.
Okay, now we're going to document that the medication was given in the right upper abdomen. That 6 units were given in the right upper abdomen. I'm going to put my initials here. Okay, Mr. Light, I'm going to give you some information on how to inject the insulin with Spro and how to store the medication, when to use it, and when you should use it. Okay?
Okay. Thank you.
Okay, Mr. Light, do you have any questions? Do you need anything?
No, not for now.
Okay, thank you. Taking off my gloves.
I have a couple of questions.
Yes.
Was any pertinent pieces of information you review before administering this medication?
Yes, the other medications that he was taking, which was lisinopril, an aspirin, and the aspirin chlorothiazide, hydrochlorothiazide.
Did this information affect your decision to administer the medication?
Yes, because the medications could contraindicate with the lispro because it could cause hypoglycemia or affect the lispro with the glucose in his body. So we need to monitor his blood glucose.
Okay. Did this information affect how you administer the medication?
Yes, because now we're going to watch his blood glucose, make sure that the medication is working and effective. And if his blood glucose earlier were at 300, we would notify the doctor.
Okay, that's all I have. Thank you so much for sharing.
Okay, I'm going to document the patient teaching. Would you like to come watch me?
Yes, I'll
Okay.
go along.